This video tutorial is all about cardiovascular disease. Cardiovascular disease is a term used for conditions affecting the heart or blood vessels. It's usually associated with a buildup of fatty deposits inside the arteries and an increased risk of blood clots. It can also be associated with the damage to arteries and organs such as the brain, the heart, the kidneys, and the eyes. Cardiovascular disease is one of the main causes of death and disability in the UK, but it can often largely be prevented by leading a healthy lifestyle. Cardiovascular disease puts an increased strain on the heart and can lead to angina, which is chest pain caused by restricted blood flow to the heart muscle, heart attacks, where the blood flow to the heart muscle is suddenly blocked, or heart failure, when the heart is unable to pump blood around the body properly. Now, there are many different types of cardiovascular disease, but one of the main types is coronary heart disease. Now, the coronary arteries supply blood to the heart muscle itself. Coronary heart disease is usually caused by a buildup of fatty deposits on the walls of the arteries around the heart, known as the coronary arteries. The buildup of these fatty deposits makes the arteries narrower, restricting the flow of blood to the heart muscle. This means that the flow of oxygen-rich blood to the heart is blocked or reduced, so the oxygen is not going to be available for respiration. The most common symptoms of coronary heart disease are chest pain, angina, or breathlessness. But some people may not have any symptoms before they are diagnosed. Your risk of developing coronary heart disease is significantly increased if you smoke, if you have high blood pressure, if you have high cholesterol in your diet or high levels of lipoproteins, if you don't exercise regularly, or if you have diabetes. Other risks include being obese and overweight, or just simply having a family history of coronary heart disease. Treatment for coronary heart disease can help manage the symptoms and reduce the risk of further problems. Coronary heart disease can be managed effectively with a combination of lifestyle changes, medicine, and in some cases, surgery. With the right treatments, the symptoms of coronary heart disease can be reduced and the functioning of the heart significantly improved. If you have been diagnosed with coronary heart disease, making simple lifestyle changes can reduce your risk of further episodes. For example, stopping smoking after a heart attack quickly reduces your risk of having a heart attack again in the future. In fact, it can actually reduce it to a similar level to a non-smoker. Other lifestyle changes, such as eating a more healthy diet and regular exercise, will significantly reduce your risk of developing such a disease.